There was a big development today for those of us who care about Australia's mental health and how we're going to come back from the pandemic. Today, a brand new Deputy Chief Medical Officer has been appointed by the Prime Minister and by the Health Minister, Greg Hunt. We had a chance to talk about that and a bit more about the virus a little earlier tonight in Canberra.
This is the first time that the Commonwealth of Australia, the Australian government, has ever had such a position, and to recognise this central role of mental health as a fundamental part of our health structure, I think is a really important message. We have a high quality person, and so Ruth will now be at that table for those core decisions, and she has the support not just of myself and the Prime Minister, but of the Prime Minister's advisor on suicide prevention, Christine Morgan, from the Chief Medical Officer, Brendan Murphy, from the head of the department, Carolyn Edwards, and somebody who brings it all together and will be an advocate for mental health action right at the heart of government, but with the experience of being a practicing psychiatrist who has helped thousands of people over the years.
How do we make sure, because people are very aware of what a curve is now, that the suicide curve, the mental health curve, is dealt with the same focus, ferocity and speed that the coronavirus one was, and we don't have a curve like, and I don't say this lightly, many of those closing the gap issues around Indigenous health where up a little, down a little, but essentially the same every year for 10 years. How do we make sure that we avoid the extra 1,500 and start to eat into the 3,000 that take their own lives this year, not 5 years from now?
Yeah, so this is an immensely important project. It's deeply personally passionate for me, and what I'm focused on is making sure we stay ahead of that curve. So we came into this having invested recently $730 million in youth mental health and suicide prevention, and then another $64 million in Beyond Blue's The Way Back program for the group that is most at risk, those that have self-harmed. But through the pandemic, we have invested very specifically in support services such as Beyond Blue, again, Pat McGorry's work with Headspace, with Kids Helpline, with Lifeline. But in particular, we've brought Telehealth online, and that means people who are alone at home and isolated, they may be feeling anxiety or depression. They're able to reach out and get their medical support, have it paid for, and this has been a real revelation. And if there is an abiding legacy on the health front of what will come out of the pandemic, my hope and my belief and my commitment is to make that telehealth, which will assist in a way which hasn't really been there before, with funded medical services for mental health going forwards in perpetuity.